Hi everyone, welcome back to Doodle Nurse. If this is your first time here, welcome. Today we are reviewing Parkinson disease by focusing on the balance between two key neurotransmitters in the basal ganglia, the dopamine and the acetylcholine. Understanding this balance is essential because Parkinson disease is not just about the low dopamine alone, it's about loss of balance between inhibitory and excitatory signals. This imbalance explains both the motor symptoms we see in patients and also the rationale about Parkinson disease treatments. A little disclaimer though, this presentation is for educational and informational purposes only. Content is based on general nursing knowledge and should not replace professional medical judgment, clinical decision making, or even institutional protocols. Please always follow your current guidelines, provider orders, and most especially facility policies when caring for patients. Under normal conditions, movement is carefully controlled through a balance of neurotransmitters. Dopamine, released from the substantia nigra, works mainly as an inhibitory signal that prevents excessive or unwanted movement. At the same time, acetylcholine provides excitatory input and it promotes muscle activation and muscle tone. So, when dopamine and acetylcholine are balanced, motor signals flow smoothly, allowing for controlled, coordinated movement without stiffness or tremors. Let's talk about who does what. Let's break down each neurotransmitter's role. So, dopamine helps fine tune movement. It smooths motor activity, it prevents rigidity, and allows movements to start and stop appropriately. Acetylcholine, on the other hand, it is excitatory. It increases the muscle tone and it promotes movement, as mentioned earlier. So, in a healthy brain, dopamine keeps acetylcholine in check. This balance prevents excessive muscle activation and ensures fluid movement. In Parkinson disease, dopamine producing neurons in the substantia nigra gradually degenerate, it means decrease. As a result, the dopamine levels in the stadium decline. Even though acetylcholine levels may stay the same, dopamine is no longer present to balance its effects. This creates a state where acetylcholine becomes unopposed, leading to excessive excitatory signaling. The result is disrupted motor control and difficulty regulating the movement. So, what we are seeing clinical result. This neurotransmitter imbalance leads directly to the classic motor symptoms of Parkinson disease. Patients develop the tremors, increased muscle rigidity, bradykinesia or slowed movement, and a characteristic of shuffling gait. Because movement regulation is impaired, these symptoms together produce the disturbed and effortful movements we associate with Parkinson disease. For both exams and or bedside practice, remember this key idea. Parkinson disease is a problem of imbalance, not absolute excess or deficiency. Dopamine is low and acetylcholine becomes relatively high because it is unopposed. Parkinson treatments are designed to restore the balance either by increasing dopamine availability, stimulating dopamine receptors, or reducing acetylcholine activity. Keeping this framework in mind will help you understand medication choices, side effects, and patient teaching most especially. Thank you for learning with the Doodle Nurse. If this breakdown helped you understand Parkinson disease a little better, please like, subscribe, and share this video. It helps support free nursing education and allows this channel to reach more students and nurses just like you. Until next time, keep doodling, keep learning, and and keep taking great care of your patients. Bye.